Hello, my name is Tatiana Dale. I'm your nurse practitioner, and I want to speak to you about ways that we can prevent cardiovascular disease and increase heart health. Heart disease is one of the number one causes in the United States, but it does have modifiable risk factors that we can do, which are small, realistic changes that we can incorporate to increase your heart health and decrease your risk for cardiovascular disease. So cardiovascular disease includes heart attacks, strokes, issues with blood flow, and most of these problems are typically because arteries are narrowed and they become hardened from plaque buildup. Conditions like high blood pressure, high cholesterol, high blood sugar, smoking, stress can all be key components for speeding up the process of leading to cardiovascular disease. So when we are talking about heart health, we go based kind of off of your labs and your vital signs, and focus on the risk factors that might apply to you as an individual. So we are considering high cholesterol, high blood pressure, comorbidities such as diabetes or prediabetes, family history, smoking or vaping status, weight, diet, stress, low physical activity. Those kind of all play a part in your potential or risk for developing cardiovascular disease. So LDL is what we call the bad cholesterol. That's the cholesterol that builds up plaque, and we want it to be low. So the lower the LDL number, the better for you for preventing cardiovascular disease. HDL is the good cholesterol, or what I like to refer to as the happy cholesterol. That is the cholesterol that will protect your heart. So the higher that number, the better, because it does mean or correlate to increased protection for you. Triglycerides are the fats in your blood. They usually are affected by diet, weight, blood sugar. And so we want to decrease those numbers. Typically less than 150 is an optimal range for your triglycerides. So some key points for heart healthy nutrition that we will discuss are aiming for more fiber, fruits, vegetables, whole grains, lean proteins. Your lean proteins may include like fish, skinless poultry, things like that, but we do want to decrease your intake of red meats. And then we also want to limit saturated fats, sugary drinks, fast foods, fried foods. We can try air frying or baking foods rather than deep frying them. And also reading nutrition labels can help you avoid hidden salt or sugar intakes. And it can also display to you the amount of saturated versus unsaturated fats in your foods, cholesterol. It'll give you the entire nutritional facts on what you are buying or eating. As far as physical activity goes, that does play a big component in decreasing your risk of cardiovascular disease. So we want to aim for at least 150 minutes of moderate exercise per week, which typically equates to about 30 minutes on most days of working out. Your goal is to just kind of make movement, and making small attainable goals for yourself can help you stay motivated, such as taking the stairs instead of the elevator at work, going on a 30-minute walk per day. Just small things that you can reach at first and then continue to build up to decrease your risk of losing motivation. For weight management, also, another small attainable goal would be to lose about 5 to 7% of body weight. This can also be beneficial for lowering cholesterol and blood pressure. These are going to be gradual changes, so we're not trying to push for any acute sudden changes. So also with smoking or vaping, cessation is one of the words that we refer to it as, which is equivalent to stopping. That can be one of the biggest things that you can do to increase your heart health. So we can also offer sources, medications, support groups, multiple things that we can do to help you in your journey of quitting smoking or vaping. Stress, sleep, and mental health also play a significant part in cardiovascular disease. So high stress, poor sleep, those things can increase inflammation and blood pressure in the body. So relaxation techniques that we can discuss are breathing exercises, meditation, mindful apps if you utilize your phone often or you like to be on your phone often, if you're religious, increasing prayer or things like that, journaling, just based on your own preferences that you feel like can help increase your relaxation and decrease your stress. Also, for sleep hygiene, we really suggest 7 to 9 hours of sleep per night. If lifestyle modifications alone aren't enough, we can introduce medications like statins that will help lower your LDL or bad cholesterol and ultimately reduce your risk of heart attack and stroke by about 25 to 30%. The medication would really just be added protection, kind of to help you while you are incorporating your lifestyle modifications. So that is another avenue that we can take. There's also apps that you can utilize on your phone like MyFitnessPal, or AI calculator for your calorie intake to kind of set attainable goals for yourself in there and keep track of how many calories you might be ingesting a day. There's also like HeartWise or Fujicate that provide healthy eating education. Those are all apps on your phone that you can find. You can view your labs through patient portals, and there's also a plethora of YouTube videos that provide education for label reading of the nutrition facts, low sodium recipes, walking workouts, HIIT workouts, at-home workouts that are body weight, that you can just incorporate within 30 minutes of your day at home, which provides convenience, especially if you have a busy schedule. The American Heart Association also has a risk calculator that you can do online. So some pertinent symptoms that we would want you to watch out for if you do have risk factors or are at increased risk for developing cardiovascular disease is chest pressure, tightness, pain, shortness of breath, sudden dizziness, severe headaches. If you get a sudden onset of difficulty speaking, pain that radiates to the jaw or left arm or through your back, can all be significant things that we want you to go to either the ER for or call 911 for help. So with your goal setting, I think it's a good idea to incorporate 1 to 2 realistic goals, and then you can increase as you achieve those goals and feel more comfortable. Swap sugary drinks for water for a couple of days a week, even if you want to start slower and do like 2 to 3 days per week, and kind of work your way up from there. And then another small modifiable goal that you can do is maybe try to incorporate adding 1 serving of vegetables daily if that's not something that you typically already do, or fruits, or anything that can be beneficial to your diet. So heart disease prevention is mainly about progress and not perfection. You're not doing this alone. You can reach out to the office at any point that you feel like you need more tips, or you're feeling discouraged, or you want to know of other ways that can be beneficial for you. So if you don't have any questions, then we can begin with that plan, or if you do have questions, then we can continue to discuss from there.